infection and drug-resistant superbugs are among the top threats to global health this year. That's according to the World Health Organization.
Yeah, another top issue on the list is people refusing vaccines. Dr. Mandira Mehra joins us from SSM Health this morning to talk about why that's an international concern. Good morning.
Good morning.
So this is top of mind because of the anti-vax issue happening out in Portland, where they actually declared a public health emergency because of a measles outbreak there.
Exactly. And every season, it's hard to say season now because it happens a couple times a year, but this used to be a really controversial topic, and now it's an international threat. So just like you said, Danica and Leah, the World Health Organization has released their top 10 global threats. So we're talking about global warming, superbugs, and amongst Ebola and things like that are people that have vaccine hesitancy. What is vaccine hesitancy? I read a great article that explained it would be like me roaming around not taking a shower, people holding their nose, showing me data that I probably should shower. That would be called shower hesitancy. Despite obvious evidence and data that you should do something, people still have this hesitancy. So unfortunately, vaccine hesitancy is the not vaccinating or the hesitancy to really do that despite scientific data. The reason this is an issue and a global threat is because things like this measles outbreak are becoming more common, especially in countries where the disease was basically eradicated. Now, of course, vaccines are not the only reason, but they do play a very big role. So the big take-home message here is it's now a global threat, and please talk to your doctor, look at the scientific evidence, vaccinate your kids. Other global threats included things like superbugs, so really resistant bacteria, viruses, to just the fact that we have antibiotics and medications to treat these things. But of course, the bacteria, the viruses are very smart and they adapt. So TB, tuberculosis, is a very big, prominent global threat. But now we're running out of medications to treat them. So again, global threat issues also include things like global warming and how that affects the environment and ultimately our health. So lots of things on that top 10 list, but amongst things that we can do that are preventable, definitely vaccinate.
Right. We're talking about keeping our families healthy here a little bit more, and moms carry a lot of that burden. There's actually a new study out showing just how much they might carry that burden. I'm sure you can relate a little bit.
Of course, yes. I think every mom out there should support and love other moms for that exact reason. You know, when you become a mother, we were joking in the commercial break here that maybe that invisible labor starts even before you become a mother. Already you're kind of bearing the physical, the mental burden or stress or adjusting your life. But this study was amazing. It showed that despite women even working equally, despite women being very educated, having college degrees, having other degrees, they still really had that burden, that onus of taking care of a lot of the invisible household tasks. So I know a lot of men are super helpful. They'll say, well, honey, I'll cook dinner tonight, or hey, I'll take out the garbage, that kind of thing. So even though they're helping out physically, a lot of the burden still falls on the mother. For example, those checklists, those constant checklists of, will we have clean towels tomorrow? Who's getting lunch? Who's packing, you know, X, Y, and Z?
Which kid need to go and when?
Exactly. Being that chauffeur. And you know, there's that cartoon where the man and woman are watching TV and the man's just watching the game and the woman has this bubble of 25 things that she still has to do. So it kind of is said in jest, but it's a very real thing. So the reason this is important is that mental health, emotional health of a woman is very dependent on how much of that burden she feels. And a happy, healthy woman makes a happy, healthy child, makes a happy, healthy family. So anything we can do to help women out, even as a society, forming groups, chats, anything we can do makes, again, happy, healthy families, happy, healthy women.
Really interesting study there. An important issue to highlight.
Of course.
All right. Thank you so much for joining us, Dr. Mehra.
Great to be here.